Hip replacements are performed for patients who have arthritis in their hip. When the hip wears out to a certain degree, it becomes severe enough to require hip replacement surgery. This is usually guided by the amount of pain and disability caused by the wear in the hip itself. A good indicator of ongoing pain needing hip replacement is having pain at night or pain at rest. The first signs of needing a hip replacement are groin pain in the groin area, where the pain prevents the patient or the person from being able to walk and perform their normal activities of daily living. The patient may notice a decrease in their walking distance, in their ability to get in and out of a car, to take public transport, to do the shopping, and to go about their normal daily life. Their activities decrease to a level that they're unable to cope with the pain, and that leads to the assessments which may end up showing that the patient needs a hip replacement surgery. The average age for a patient having a total hip replacement in this day and age is between 65 to 75. That's the range that most people would have a hip replacement, although the age is creeping up as we are living longer and are healthier in our lives. The average age is certainly creeping up. There is no right or wrong age to have a hip replacement. It all depends on your symptoms and the severity of the arthritis. In other words, you have the operation when it is required and when the symptoms are bad enough to have the operation. Minimally invasive hip replacements are done in various ways in an approach to try and preserve as much of the muscles and the soft tissues as possible while doing the operation safely. And the most important thing is to do the operation safely and accurately. I do the anterior approach under X-ray guidance in a muscle-sparing approach, going through the front of the thigh to the hip by sparing the musculature. I go between the intervals between two groups of muscles, two layers, down to the capsule of the joint, and have access to the hip joint using special instruments, special retractors, X-ray guidance, and a traction device to be able to access the hip. It's all about instrumentation and having the right kit and the right tools to access the hip. A recovery usually takes 6 weeks following minimally invasive anterior approach hip replacement. The recovery is dependent on the patient as much as the surgery. It all depends on the motivation as well as the diligence in doing the physiotherapy and following all the instructions following before and after the surgery. And every patient is different. Some people recover within 2 to 3 weeks, and some people recover within 6 weeks.